Hi everyone, my name is Graciela and today I would like to introduce the topic that has been covered in my comparative evaluation report. It is about decision support tools for cancer patient participation in decision making. So the rationale behind this study was inspired first of all by my personal experience that relates to family members with cancer diagnostic. A second interest is about patient-centered care technologies and how they affect clinical environments. A third motivation is about the need for technological interventions in the cancer setting to support patient decision making. So cancer care has been declared critical in the United States since 2013 by the Institute of Medicine, and the information needed to make informed decisions is not getting to patients and their families. Considering that over 14 million individuals suffer from cancer only in the US, and the projection by 2024 will reach 19 million, the scenario is complex. In the United Kingdom, a similar situation happened. Around 2 million people suffer from cancer, and by 2013, this number is expected to be double. Unfortunately, cancer patients do not comprehend their disease or the treatment in the first consultation, and they experience great concern and high levels of distress. On the other hand, oncologists have conflict when the information needs to be presented to patients during consultations. So this evaluation report was developed under a conceptual framework of the literature review. First, there was a synthesis of material related to patient participation for decision making and also cancer. Several articles were included from different sources to make a relevant report. The evidence acquisition included Medline and Elsevier databases, Google Scholar, and the University of Melbourne Library Catalog. There was material related to the project, however, was not included because of the limited size of the report and also due to the lack of resources. Some of those technologies were in telehealth, and some other technologies were algorithms and statistical models for guiding decision of patients. The definition of the criteria was based on two main components: patient-centered care and decision support, all within the cancer setting. However, for the purpose of doing an understandable and transversal comparison, the main concept, patient participation in decision making, was subdivided into specific components. So we have communication in the patient-clinician relationship. We have decision support making. We have level of distress, and also the role of patients in terms of their engagement and the usefulness of the application. Some of the interesting findings so far are shown in this first table. The specific component to be evaluated is communication. The tools that belong to the web-based category are three: Web Choice, breasthealthdecision.org, and Focus Program. So as you can see from the first box, the use of this application has shown a decrement in patient concerns about communication. Nurses have reported that patients were more prepared at the moment of sharing their symptoms, increasing their sense of coherence and control. This evaluation has a positive impact for the purpose of this report. When web choice is used, more symptoms are addressed by patients in consultations. So this is also a positive evaluation. In the second tool, it is not clear the efficacy. However, in terms of patient knowledge, appears to be beneficial. In this case, knowledge in patients has been considered as a positive factor. In the third tool, the use of the focus program has not shown great evidence in communication changes. However, patients and caregivers were more likely to share concerns and clarify misunderstandings. So in this case, we have both effects, positive and negative. In this second table, for example, we are measuring distress, levels of distress. So in the first application, evidence shows that intervention in web choice groups had notorious improvements in feeling less depressed. However, by other authors, the same applications is not as good as the first evaluation. So patients are supposed to gain support, however, by using decision aids like web choice, feelings such as suffering and uncertainty might increase. So that's why 30% of patients with access to these applications do not use them. The second tool says that patients have experienced less confusion when using the application. However, this tool has a high focus on risk assessment, and thus information about distress reduction is not clear. The last one, the use of this tool has diminished emotional distress in cancer patients, enhancing quality of life and bringing benefits not only for patients but also for their caregivers. So this is the way in which I am comparing the tools. So I have one category, web-based, and I have a second category, which is computer-based tools. For the purpose of this presentation, it's not presented in findings, and we have other two tools. So what has been observed during the construction of this report is that cancer patients have different needs, and even though specific tools are available depending on the type of cancer, not all of them are suitable for all cancer patients. It is important also to highlight that only a few studies related to IT supporting decision making were found, and in general was difficult to access full articles. However, the quality of the studies for this report is high and consistent. So thank you for your attention. If you have any question, please don't hesitate to contact me.